Hi, my name is Tendai Katere, and I'm here to present my healthy communication campaign entitled Be a Breast Cancer Survivor. Just as you can see the title, this campaign aims to raise awareness to women that they can actually check themselves and actually detect the um, breast cancer before it actually spreads to their bodies so that they can reduce their effects of death. Yeah. So one of the questions that could be asked is, what can I do to reduce my risk of breast cancer? So according to the Center for Disease Control and Prevention, they tell us that regular screening and personal checking increases your chance of beating breast cancer. Mammogram, which is an X-ray picture of the breast, is another important test doctors conduct to find uh, breast cancer early. And what should I look for when doing personal checks? So different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. Some warning signs of breast cancer are new lump in the breast or underarm, which is the armpit, thickening or swelling or part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area of the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size or shape of the breast, pain in any area of the breast. And let's keep in mind that these symptoms can happen with other conditions that are not breast cancer. And with me here, I've got a video of Joyce Turner, who is a genetic counselor, and she is here to explain some of the ways that women can actually get breast cancer and some of the things that they should be aware of, especially with breast cancer. Let's just listen to her.
About 5 to 10% of breast cancer cases are hereditary. If you had a significant family history of multiple generations of cancer, particularly breast cancer, then it would be important to speak with a genetic counselor who can talk to you about your actual risk to develop breast cancer in your lifetime and what your screening and or management options might be.
Thank you so much. And there are some actions that we can take to actually lower the risk of breast cancer. So many factors over the course of a lifetime can influence your breast cancer risk. You can't change some factors such as getting older or your family history, but you can help lower the risk of breast cancer by taking care of your health in the following ways. You need to keep healthy, wealthy, and be physically active. And you choose not to drink alcohol or drink alcohol in moderation. Breastfeed your children if possible. And above all this, you need to do regular personal checks and go for cancer screening at your local clinic. So being physically active can actually help so much in lowering the risk of your breast cancer. And for more information on this, you can actually contact the Center for Disease Control and Prevention by visiting their website. You can also visit my personal website that I have actually created, and you can also visit the National Institute for Health of Healthy, and you can also visit the National Library of Medicine. If you're in Zimbabwe, you can actually visit the Zimbabwe Cancer Association. And I would like to share with you the story of my sister, Sekai, who is actually on the picture there. The story is my sister's breast cancer survivor. So after the death of our father, that was in 2018, our sister came to us and reported that she was actually experiencing some pain on her right breast, which was also affecting her right arm. And knowing that our father had actually died from abdominal cancer And mainly because it was actually detected early, we encouraged my sister to go and actually get tested to a nearby cancer clinic. But for fear of just knowing that she's got breast cancer, and also fear of actually going through the same fate that my father went through, my sister was hesitant to go, and we had to encourage her to go there and to assure her that all will be well. Eventually, she went, and the swab was taken from her breast, and the doctor confirmed the diagnosis that my sister actually had breast cancer. And this was a very sad development for the family, especially for a family. And the doctor gladly told us that the cancer was actually in the very early stages and there was no need for us to worry, but he encouraged us to return after 6 months. After 6 months, we actually failed to return due to some financial challenges that we faced. And this to us was a very devastating development. But we then had to sit down together and we contributed the money that was needed. And eventually, my sister, she had to go through the proper test, and I was actually advised that she has to be removed. The right breast was supposed to be removed in order to remove the tumor that was in there. And eventually, this was done, and the tumor was removed. After the trauma was removed, we were glad to hear that the breast cancer had not spread to any other parts of the body, but it only affected the right arm due to the veins that were actually cut during the surgery. So after this, my sister had to go through what she described as the most painful 8 sessions of chemotherapy. After the chemo, my sister was actually declared cancer-free by the doctor. And thanks to the early detection and the treatment that she went through, my sister is still with us 5 years on, and she's actually living a normal and healthy life, taking care of her children as well as grandchildren. Thank you